I'm not a farmer. I just want to echo what Diane was saying. I'm not a farmer, but my in-laws are farmers. We're farmers if we're really in Alberta. So I understand the issues and challenges and opportunities. So it's a great honor to be here. Thank you all, the Alberta Elk Commission inviting us, prevent to come in here, and the board members and also her, I really appreciate it. So what we want to do is to give you an update of Prevent, who we are, and what we do, and our CWD, and our Dr. John Mapletop, a young scientist, is going to give you a CWD update, and also the vaccine development, and followed by some partnerships discussion, and then with questions and answers. So, basically, when you look at our vision statement, is we bridge research to commercialization gap, and we fast track vaccine development. So, who are we? We are a non-profit organization, and we are a center of excellence for commercialization and research in vaccine development, and we are funded by the federal government. So we have three key partners. On the far right is Canadian Centre for Vaccinology in Halifax. In the middle, we have VIDO and Intervac, University of Saskatchewan, and also we have British Columbia Centre for Disease Control. Without these three partners, we would not be here today. So this is a very brief description of our structure, and just last year we added a new position as a Chief Operating Officer, and on the far right you can see the Funding Advisory Committee. This committee was formed last year, and a multi-sector advisory committee council, what they do is they recommend, evaluate, and recommend vaccine to our board members and to make the final decision. So a lot of the diseases today are transmitted from animals to humans. So wouldn't it be great, I always like to look at research and look at future. Wouldn't it be nice to have some novel vaccines to prevent infectious diseases such as HIV, hepatitis C, cancers, breast and prostate cancer, lung cancer, and what about CWD, E. coli, and West Nile virus? And what happens is that when you have these novel vaccines, you can reduce healthcare costs and socioeconomic burden, and most importantly, is to improve quality of life. So people ask us, like, why do you take these vaccines to develop, and how do you do that? It's very simple. We consult with public health authorities from coast to coast. We came to Edmonton, we went to Alberta. We asked public health people, what are your vaccine preventable disease issues of your priority? So with that, we took the information, we have the top 10 vaccine preventable diseases. So we went out and looked for technologies at universities or biotech companies to match the disease development, the vaccine development. And then we fast-track these vaccines development. So this particular diagram over here, it tells you that, first of all, public health, disease issues. Then, are there any technologies available to match and work with the diseases? And then also we have to look at our own needs. So this particular, over here at the bottom, you can see here is that we have promising vaccine technologies from academia, from biotech companies, and then the technology evaluation and selection. The management team make the decision, and they recommend that to the MAC council, and then the MAC further evaluate and make recommendations to the board, and board makes the decision and say, okay, let's go forward with this vaccine development. So where do we fit in this picture? So if you look at this particular section here, this is where prevent comes in. We conduct clinical trials, early phase clinical trials. So what have we done up to now? We have developed 3 technology platforms: protein misfolding diseases, infectious diseases, and adjuvants. So we have signed licensing agreements to develop 1 animal vaccine, that is CWD vaccine, and 5 human vaccines. So under infectious diseases platform, the first vaccine we are looking at is the RSV vaccine. The second one is Rogue streptococcus, chlamydia, and seasonal flu vaccine. Quickly over here, every single child, no matter where you live in the world, by age 3, every single child will have the virus. And 1 to 2% will have severe infection. Rogue streptococcus, very invasive bacteria in hospital situations. But in communities, you heard about flesh-eating disease, which is caused by Rogue streptococcus. Chlamydia is a silent disease that most people don't even know. It causes pelvic inflammatory disease and can lead to infertility. Seasonal flu, there are quite a few on the market, but we are looking at one to give you a longer duration of protection and wider spectrum of protection. So, protein misfolding disease platform, there are 2, chronic wasting disease and ALS. If this technology is successful, we can expand that into dementia, Alzheimer's, and even cancer. So this is interesting here. I was driving from Saskatchewan to Manitoba. As soon as you cross the border, what do you see? Prevent CWD. Don't bring CWD into our province. So having said all this, I'm going to have Dr. John Mapletop to come up here and give you an overview of chronic wasting disease as well as the vaccine development.
Thank you, Peter, and thank you very much for giving us the opportunity to come and speak with you today. As Peter indicated, my name is John Mapletop. I'm Business Development Manager and Project Manager at Prevent, and I'm just going to give a quick update on the vaccine. I'd like to talk about 3 things, a little bit about the problem with which we're all very familiar, the vaccine as a potential solution, and then a little bit on our progress to date. So first, the problem. As we're all aware, CWD is chronic wasting disease. The chronic means it takes a long time for the disease to develop. And the wasting disease is the debilitating brain disease where we have a gradual loss of normal brain function that eventually results in death of the animals. This is kind of what the top-down picture looks like for CWD. This is a map published by the United States Geological Survey. And if you're ever looking for this information, you can find it on the internet. If you just Google USGS CWD, you'll find this map, and they update it fairly regularly. But as you can see, kind of here in the Colorado, Wyoming area, this is basically where the disease was first discovered in the late 60s. And since then, it's moved up into Western Canada, down into the southwestern United States, east into the Midwest, and now even further east towards the coast. Something interesting about this map is you've got these hot spots where it's concentrated, then you got a lot of white space in between. So unfortunately, I think there's a couple of possibilities what's going on in that white space, and neither of them are good. Number one is it's already there and just hasn't been discovered. Or number 2, if we're unable to do anything about the disease, it has a good chance of ending up there in the future. So now I'd just like to talk for a few minutes about the vaccine as a potential solution. CWD is caused by a misfolded protein in the brain. And the best way to think about a misfolded protein is just like a piece of paper. A piece of paper can be folded nice and neat, or it can be crumpled up. And a protein can more or less be the same way. If you have a normally folded protein, there's no problems. This is a naturally found protein, and there's no disease. But if you get the misfolded protein, this is what causes the disease. And the worst part about the misfolded protein is that it is infectious and transmissible. This means it can spread within the body of the animal and make the disease progress in the animal, and it can also spread from one animal to another, and that's how the disease has spread across North America. So how can we protect against CWD? Well, what we're hoping to do with the vaccine is to eliminate the misfolded protein while leaving the normally folded protein alone. And our vaccine, just like most of the other vaccines, induces antibodies. And in this case, these antibodies specifically target the misfolded protein while leaving the normally folded protein alone. So I'm just going to very quickly show you how this works. I've got a diagram here in red and black, and this is going to represent our normally folded protein, which does not cause disease. And as I said, just like a piece of paper, it can be misfolded. That changes the way the protein looks. And when it's misfolded, again, this is what causes disease. So I'll just show you that again. You go from normally folded, and it becomes misfolded. And in particular, I'll get you to pay attention to this black triangle here. So what our vaccine does is it generates antibodies that attack a specific part of the protein that is only exposed on the misfolded protein. You compare this to the normally folded protein, and you see in this case, this black target region is kind of trapped in the middle of the protein, safely tucked away, and the vaccine antibodies are not able to attack it. So this is the basis for both how the vaccine is intended to work, as well as why the vaccine should be safe. The vaccine can attack the misfolded protein, but it cannot attack the normally folded protein. So now a little bit on our progress to date. Because CWD is a problem in both farmed and wild animals, it's felt that ultimately the only way, if we have a chance of solving it, the only way to do it would be to attack it on both fronts. To attack it in the farmed populations as well as the wild populations. So we've always conceived that this would be a two-phase project. Right now we're working on an injectable vaccine to be used primarily in the farmed animals, with maybe a limited application in wild animals. But later on, because it's no good if the disease can keep coming in from the wild animals, we intend to develop an oral vaccine which could be deployed in the wild. And the questions come up, how would you do this in the wild? And there's actually a precedent. A company called Marielle has a rabies vaccine called Rab Oral. And what they do with that is they've got these little foil packets that contain the vaccine, and they just wrap them in a food bait and then scatter them into the wild. And the animals come along and bite through the food, and all they have to do is break the foil on the packet. They don't even have to eat the whole thing, and that's sufficient to vaccinate the animals. So there is a precedent for this. It can be done in the wild, and once we're finished with the injectable vaccine, we're going to pursue an oral vaccine for CWD in the same way. So where are we right now? This is the basic pathway for approval of an animal vaccine. You start by discovering the target for the vaccine. I'll remind you, that's that black triangle piece that's exposed on the surface of our misfolded protein. Then you actually have to produce the vaccine. You have to produce vaccine for use in your testing, as well as your final fully manufactured product that comes in the box with the label you get from your veterinarian and so forth. And then in terms of showing that the vaccine works, you have to do two things. One is demonstrate that you're getting the antibody response. Number two, demonstrate that the vaccine is safe, because we want to avoid any unintended side effects. We don't want to do something that's going to make the situation worse. So we're very conscious of this and constantly monitoring this. And then finally, you have to make sure that it's efficacious, that the vaccine actually works, that the antibodies we're inducing are doing like we say they should and actually neutralizing the prion and stopping or slowing down the disease. And in the case of the efficacy, what we actually do there is immunize the animals and then deliberately infect them with CWD, and we hope to see that they will, that the vaccine will slow or stop the disease. And in all three of these, antibody response, safety, and efficacy, we do them in multiple species to make sure it's working, and that culminates with our target species in elk and of course also deer. And then later on, essentially the exact same pathway gets repeated with the oral vaccine. So where are we right now? I've color-coded things here to show where our progress is at. Anything that's green is complete, blue is in progress, and red has yet to begin. So as you can see, the injectable vaccine is quite a ways ahead of the oral vaccine. As I indicated, it's going to come later, and ideally what we want to do is, if we can get this on the market, is generate revenue from selling the vaccine that can be reinvested in the continued development of the oral vaccine. But for today, let's focus on the injectable and where are we. As I said, we've discovered the target, that was that black triangle, and we're in the process of making vaccine. We've made vaccine for testing purposes. We're in the middle of manufacturing the final product, which is what you'll see on the veterinarian shelves if the vaccine is successful. In terms of antibody response, we've shown that the vaccine is capable now of inducing antibodies in all three of these sets of species, mice, sheep, and elk and deer. And not only that, but we've also shown that the antibody, like predicted, will only bind to the misfolded prion. It will not be able to attack the normally folded protein. And that leads next into our safety study. We've completed several safety studies now, and we're happy to say that to date, there have been no safety issues whatsoever identified with regards to CWD. And again, the basis for that is that the antibody cannot attack that normally folded protein. As for efficacy studies, these are in progress now. As you're aware, one of the major challenges of this vaccine program is that the disease takes a very long time to develop. If you look at another disease, for example, like flu, if you challenge a person or an animal with flu, you can have an idea if the vaccine works or not, basically within a week or two. In our vaccine situation here, it could take a couple of years to tell if the vaccine is working or not. So we have studies in progress, and we're happy to say that 2013 is when we're starting our target species challenge experiments. One of them just started in Wyoming, and later this year at the International Vaccine Center in Saskatoon, we're going to be starting an indoor biosafety level 3 containment experiment in which we're going to immunize the animals and, as I said, deliberately infect them with CWD, and hopefully we'll see that the vaccine is able to slow or stop the disease. These two studies, though, will take a couple of years to run, and then we're thinking it may take another year or so after that, if the vaccine is successful, to deal with the regulators and get all the approvals. So we're looking at a few years before the vaccine is available.
Quick question. Is it a vaccine that you just give once and it gives coverage for life, or is it something, because it's in the environment and animals could be potentially reinfected all the time, is it something that has to be given every so often?
Right now we're targeting a year of immunity once you get the animals up. So maybe the first time they get the vaccine, they might have to get it a couple of times to get their immunity up, and then every year thereafter get a boost. We wanted something, the first goal is obviously something that works, and then something that kind of fits with normally handling procedures. So if you had to administer this vaccine every month, it wouldn't be any good because no one wants to handle their animals that frequently. We figure to start with a couple of times a year is not bad, and then if we can get a year's immunity, it'll be a useful product. And if we get it on the market, what we can do is monitor, see how long the immunity lasts, maybe reduce the number of immunizations. As you're aware, a lot of the immunizations that we receive as people, tetanus, for example, you might get 10 or 20 years immunity from that vaccine, but we have to get it out there to see how it works. It's a very good question. Now Now, one of the nice possibilities though is there might be ways to take advantage of the vaccine before it's approved. We're talking with regulators right now about doing large-scale safety studies with the vaccine, in which hundreds to maybe low thousands of animals might be able to be immunized on a test basis, and all of those animals would presumably, if they went to slaughter, they'd have to be tested for CWD to make sure there's no unintended side effects from the vaccine. But we're in negotiation with regulators right now. We're looking at starting a study in Saskatchewan maybe as early as this fall, and there may be opportunities to do something similar in Alberta. But it's stay tuned for more information on that. So just to summarize, the problem unfortunately appears to be getting worse, and as I showed with the map, we maybe don't even know the full extent of the problem. But the vaccine could be part of a potential solution. It works by targeting the misfolded protein while leaving the normally folded protein alone, and this is the basis for why it should work, and also why it should be safe, which is very important. And again, all studies to date have shown that with respect to CWD, we haven't seen any effects, negative effects there. And then we're starting with the injectable vaccine, but by having a plan to go to the oral vaccine, we'll hopefully have a solution for both farm and wild cervids. And again, the exciting thing for us now is that our efficacy trials are starting here this year. So, a couple years hopefully for the trials, and then another year or so after that. We hope to have a solution available in a few years. With that, I'll call. Should I take questions right now, Peter? Is that fine? Yeah, please go ahead with a few questions.
Just expand